Hello everyone, welcome to Medicare 101, and whether you're turning 65 for the first time or trying to get some more Medicare information, you are in the right place. If you are thinking of choosing a Medicare Supplement plan, let's do a quick overview on what that looks like. When it comes to Medicare Supplements, you're gonna have Part A, Part B, which is your original Medicare, and then we're gonna look at adding a Medicare Supplement. Sometimes a prescription plan will go with that. As we take a deeper dive into that Medicare Supplement plan, here are the plans that you can choose from. Now, you have all these crazy letters up here, and I'm here to tell you, after doing this for over a decade, there's really only 3 plans that I ever see anyone choose. The Plan F, the Plan G, and the Plan N. If you went on to Medicare after January 1st of 2020, then the Plan F is no longer available to you. That leaves us with the Plan G and the Plan N. And as we dissect these 2 plans, they're essentially gonna cover 100% of the Medicare approved charges that Medicare doesn't, with the exception of this Part B deductible. In 2026, that deductible is $283 when it comes to that deductible. Same thing for the Plan N, $283. Plan G, after you pay that $283, Medicare approved expenses, you're in good shape. Plan N, $283. You also have these Part B excess charges, which essentially, if your doctor charges more than the Medicare approved amount, you may have a small excess charge. All right, you're going on to Medicare, or you already have Medicare and you're locked in on a Medicare Supplement plan. The next question I get is, Chase, what is the cost of a Medicare Supplement plan? Well, my answer to that is you give me your zip code and I'll give you a cost. Typically, the average rate for a Medicare Supplement Plan G, which is the most popular plan for beneficiaries new to Medicare, ranges from $100 to $200 a month. If you're paying more than $200 a month, you need to reach out. If you're going on to Medicare for the first time, make sure you don't overpay. We'd love to talk. If you're going on to Medicare and you're deciding between a Plan G and a Plan N, let's compare the 2. When it comes to the Plan G, you're looking at an average premium, depending on your zip code, of $100 to $200 a month. What you pay for, after you pay that Medicare Supplement premium, you're responsible for the $283 a year deductible here in 2026. After that, all Medicare approved expenses are taken care of. When it comes to the Plan N, almost the same plan. It's gonna be about $20 cheaper, maybe $30 cheaper a month, depending on your zip code. And then what you're gonna pay for, you're still gonna have that $283 deductible. The difference here is you may have a copay of $20 when you visit your local doctor, or $50 if you have an ER visit and you're not admitted. If you're admitted, that thing's waived. And the number 4 here, if you have a doctor that charges over the Medicare approved amount, you could have a Part B access charge with a cap at 15%. Enrolling into a Medicare Supplement for the first time, let's talk about some key points in the standardization of these plans. The best time to enroll in a Medicare Supplement plan, 6 months before you turn 65. That's a common misconception. A lot of people are hearing 3 months. Really, when you're turning 65, you have a 6-month window that allows you to get the best price, avoid mistakes, and check it off your list. So 6 months before, that's when we want to start zeroing in on those Medicare Supplement enrollment dates and get that locked in. Standardization of these plans, I cannot say it enough, these are federally standardized plans. So no matter what carrier you choose, whether it's Company A, Company B, or Company C, they all have to offer you the exact same plan. The only thing different with those plans is the price that you pay. So make sure when you're shopping for these things, you're using a broker, you're not overpaying, and you get the best rates that you can get. If you're going on to Medicare and thinking about using a broker, let's tackle some myths. Myth number 1, I must have to pay a fee to use a broker and get all their help with this. Truth is, we charge you absolutely no fees of any kind for our service. It is 100% free to use a broker. Myth number 2, nobody works for free, so the insurance company must charge a higher price if I go through a broker like you. And the truth is, you're gonna pay the exact same price whether you use a broker or whether you do this on your own. And with over 30 years of combined experience, it is gonna dramatically benefit you to use a broker. Myth number 3, if you get paid by the insurance companies, you must have a bias towards one insurance company or the other. And the answer to that is completely false. With over 25 companies that we represent, 25 companies to choose from, we work for you and not the insurance company. So to wrap it up, the 3 truths about using a broker is there's no fees charged of any kind. The price you pay to the insurance company is the same with or without a broker. And then number 3, with over 25 companies to choose from, we have no bias. Medicare prescription drug coverage, one of the most complicated parts of Medicare, and I'm gonna solve it for you here in the next 60 seconds. When it comes to prescription drug coverage, it is a very, very individualized conversation. And typically when you have prescription drug coverage, you're gonna have original Medicare, you're gonna have a Medicare supplement, and potentially a prescription drug plan. And what I always like to say when it comes to these prescription drug plans is one thing you need to be aware of: if you don't sign up for these when you're first eligible, you could accrue a lifetime penalty of 1% for every month you go without one. Our process is super simple. We're gonna input your drugs into Medicare's online calculator. We're gonna choose your pharmacy. We're gonna compare all the plans available in your zip code, and we're gonna help you enroll in the plan of your choice. We're gonna reevaluate these plans every year during the annual election period, which is October 15th through December 7th. Okay, if you're zeroed in on original Medicare with a supplement, here's what that looks like. Original Medicare, you're gonna have your monthly premium for Part B of $202.90. You're gonna have your Medicare supplement, whether it's a Plan G, a Plan N, a Plan F if you're eligible. That price is gonna vary by the zip code, and then a prescription drug plan if you choose that. Remember, if you don't choose a prescription drug plan when you're first eligible, you could accrue a lifetime penalty. Lastly, don't forget about your umbrella coverage. That's gonna cover the major exposures that Medicare does not, including your cancer, heart attack, stroke, your hospital, and your extended care stays. Okay, Medicare Advantage plans. These are a little more individualized conversations, and I wanna summarize this here in the next 60 seconds. When it comes to Medicare Advantage, these are managed care plans, and what that means, you are actually leaving Medicare and going on to a privatized plan that is managed by a private insurance carrier. These plans must include the same basic benefits of Part A and B, and many of these plans are going to come with prescription drug coverage as well. Now, when choosing a plan, understand these plans can be as low as $0 per month. The one thing you cannot get away from is that Part B premium. You will have your Part B premium unless you have some special qualifications of $202.90. The coverage now, we need to be aware of the coverage. You're gonna have copays, you're gonna have deductibles, you're gonna have co-insurance and a max out of pocket. Every plan is different. We're gonna look at these by zip code and find which one is best for you. We never, ever, ever recommend a Medicare Advantage plan without umbrella coverage, and that is Medicare Advantage in 60 seconds. If you're on Medicare and thinking about choosing a Medicare Advantage plan, how do I decide? The first thing we're gonna wanna look for is zip code. Medicare Advantage plans are really condensed down by zip code. So when we type in that zip code, it's gonna give us all the options available within your zip code within your county. Number two, we wanna look at doctors, hospitals, and medications. So once we look at zip code, once we look at doctors, hospitals, medications, it's really gonna start narrowing down your search to a plan that's right for you. And then finally, we're gonna look at extra benefits. Is the gym, is the dental, is the vision, is the over-the-counter benefits important to you? And with those three things in mind, we can help you find the right plan for you. If you're looking into a Medicare Advantage plan, when is the best time to sign up for these plans? Well, if you're turning 65, it needs to be in that 3-month window, either before you turn 65 or after you turn 65. So you really have a 7-month stretch, including your birth month, that you can enroll in these plans. Other than that, if you're already on Medicare and you want to get in a Medicare Advantage plan or change your Medicare Advantage plan, you have to wait each year from October 15th to December 7th, or there's a small window from January 1st to March 31st where you can make a one-time change. If you're going on to Medicare or if you're already on Medicare, these are the letters you need to be aware of. Parts A, B, C, D. What do they mean? I'm here to solve it. When it comes to Part A, we're thinking hospital. So what does that mean, Chase? Hospital would be anything inpatient. Part B, that's gonna be your doctor services. So think family doctors or outpatient services fall under Part B. Part C is also known as your Medicare Advantage plan. So when you go onto this plan, you're actually leaving original Medicare A and B and going to Part C. And Part D is going to be your prescription drug coverage. Those are the parts of Medicare you need to be aware of. Medicare supplements. If you're going on to Medicare and you're thinking about choosing Medicare supplements, let's do a quick overview of which Medicare supplement may be best for you. There's really 3 Medicare supplements I see when people are going on to Medicare or choosing a Medicare supplement for the first time. And that is the Plan F, the Plan N, and the Plan G. The Plan F is going to be the most comprehensive Medicare supplement plan available. If you went on to Medicare after January 1st of 2020, this plan is no longer available. But when it comes to this plan, you're just going to pay your monthly premium, and as long as your charges are Medicare approved, you pay nothing else. Pay your premium, your Plan F kicks in, as long as it's Medicare approved, you're in good shape. When it comes to the Plan G, that's going to be the second plan, the second most comprehensive plan. This plan is going to be almost identical to the Plan F. The only difference is you're going to have a $283 once a year deductible. Once you satisfy that deductible, it essentially turns into that Plan F. And again, as long as your charges are Medicare approved, your Plan F and Plan G are gonna pay those. Plan N, you still have that $283 deductible. Now the difference with the Plan N is you could have a copay when seeing a doctor, or if you go to the emergency room and you're not admitted, you could see a copay as well. The big difference here is going to be the excess charge. There is a 15% excess charge if you see a provider that charges over the Medicare approved amount. So at the end of the day, when it comes to Medicare supplements, you're most likely looking at a Plan F, a Plan G, or a Plan N, and we're here to help you make the right decision. And as we wrap this up, I want to go through our three-phased approach. So today, phase number one, we're basically knocking out phase number one. You're getting the Greening Health and Wealth online content, today's educational workshop and seminar, and then you'll get a free copy of 64 Plus. And that's a #1 bestseller that will really take today's presentation in a book format and help you kind of slow it down, maybe circle things and take notes if you need to. And then phase number two, the most important phase, is schedule your free consultation. Make sure that you get your individual questions answered. And we have a ton of incredible people at Greening Health and Wealth that are standing by, ready to answer those questions. We've serviced thousands and thousands of Medicare beneficiaries across the country, and again, have that 5-star service and BBB accreditation to prove it and back that up. So we'd love to talk with you, would love to answer those questions, would love to help you plan for your Medicare and retirement transition. And phase number three, that's our free lifetime billing and claim service. So we have a great full service team that's going to handle any billing, any claims, any service, and really provide you the holistic support on the insurance side that you're going to need throughout your retirement years. So can't wait to hear from you, can't wait to answer those questions. And then again, I want to remind you that every year we're going to be there for you. We have our free annual reviews. So every year, October 15th to December 7th, that's going to be another chance to meet and make sure you have the right plan, not just this year, but for years to come.